Hi, everyone. Welcome to RxConnect. This is a podcast brought to you by the Pharmacy Operations Department with American Oncology Network. I'm Cassie Perkey, and I'm one of the oncology pharmacists here at American Oncology Network. And RxConnect is a monthly podcast where we will break down updates in oncology pharmacy as well as practical tips for patients managing common treatment side effects at home. So, in this series, we'll be talking with pharmacists and providers who work really closely with patients every day so that you can feel more informed and confident going through your treatment or getting ready to start treatment. So, before we get started, just a quick disclaimer: this podcast is intended for educational purposes only. We may discuss medications that have off label uses. And this is not medical advice. Every patient situation is different. So please always talk with your provider and pharmacist before making any changes to your medications or your care plan. But today's topic is one of the most commonly talked about side effects that we can see with chemotherapy, and that's nausea and vomiting, and what you can do at home to manage it. So I'm joined by Dr. Nicole McMullen, who is a board-certified oncology pharmacist with American Oncology Network. Dr. McMullen did her oncology training at the James Cancer Hospital at The Ohio State University Wexner Medical Center, and she has 18 years of experience working with patients receiving chemotherapy. Thank you so much for being here, Dr. McMullen. Nausea and vomiting are some of the most feared side effects of chemotherapy. So let's start with the basics. When does nausea typically happen after chemo? Is it something that happens right away, or can it happen even days after treatment?
Thank you, Cassie, for inviting me to be on the podcast. So I agree. When I meet with patients to discuss chemotherapy and side effects of chemotherapy, often the risk of nausea and vomiting from chemotherapy is their biggest concern. So nausea can start as early as a few hours within receiving chemotherapy. However, most patients usually don't experience nausea until after the day of chemotherapy. And this is because we typically give patients medications to prevent nausea on their day of treatment before they receive chemotherapy. So, nausea that occurs within the first 24 hours of receiving chemotherapy is called acute nausea. And patients can also experience delayed nausea that occurs beyond 24 hours after chemotherapy, and it can last up to 5 days. So, in order to minimize the risk of both this acute and delayed nausea, patients typically receive anti-nausea medications before chemotherapy, and often you'll hear some of the healthcare professionals refer to these medications as pre-medications. Depending on the type of chemotherapy that a patient receives, they can be given multiple medications before chemotherapy to prevent nausea and vomiting. So we do this because when patients receive chemotherapy, different signals are sent to the brain that cause nausea and or vomiting. And so by blocking these signals with these anti-nausea medications, we then help to prevent nausea and vomiting from occurring during chemotherapy. So that's why oftentimes you may have one medication beforehand or you can have multiple. Patients will also be given a prescription for anti-nausea medications that they can take at home in case they experience nausea or vomiting when they leave the infusion center.
That makes a lot of sense, Dr. McMullen. Thank you for kind of explaining the difference between, introducing the fact that there's acute nausea that happens more early on and then delayed nausea, because I think that there's a misconception that nausea really, it can happen just like immediately, and then you may not see it for those days after, but really those days after can be some of the most important that we need to manage with medications. Um, One thing I wanted to ask, there are a lot of different types of chemotherapy and various combinations. I was wondering if you could explain more about how the risk of nausea varies depending on chemo, uh, you know, depending on which chemo drug and how that can impact what medications they are prescribed to go home with.
Definitely, that's a great question. And I get that a lot because what some people don't realize or patients realize is there's over 100 different chemotherapy drugs that are used to treat certain types of cancer. And those different drugs have different risks of causing um, nausea from chemotherapy. And so the risk of nausea and vomiting from chemotherapy is dependent on the type of chemotherapy that's prescribed by your doctor. And we actually break it down to 3 different risk categories. We have high risk chemotherapy drugs, we have moderate risk and low risk. And again, that's what we classify as a risk for nausea and vomiting. So patients are typically prescribed anti-nausea medications based on the level of chemotherapy that they're receiving. So for example, if I have a patient who is receiving chemotherapy that's considered high risk, we may give more than one anti-nausea pre-medication before their chemotherapy. In contrast, as another patient may be receiving a chemotherapy drug that's classified as low risk, and so they may receive only one anti-nausea medication before chemotherapy. So it's important that you're not always comparing anti-nausea medications that you receive with maybe somebody else that's receiving chemotherapy, because that all different chemotherapy drugs have a different risk level. So, in addition to the pre-medications that you're receiving, that risk level of chemotherapy will also determine what prescriptions for anti-nausea medications your doctor will prescribe for you at home. So, again, if you are getting a low-risk nausea medication, chemotherapy medication, you may only receive one anti-nausea medication to take at home. But if you are on a chemotherapy treatment that's higher risk, then you may have more than one anti-nausea medication to take at home.
I really like how you pointed out that patients should not compare their anti-nausea regimen uh, with another patient's because, yeah, there's so many different kinds of combinations. And yeah, the person next to you might be getting a drug that may cause very little to no nausea, while your regimen may be a little bit higher risk and you may have more on your list. So definitely another thing that you'll want to have a more specific conversation with your doctor on what to expect there. But some of these anti-nausea medications, like you said or alluded to earlier, they can be given before chemotherapy while you're in the infusion room. But what are the common medications that patients could be prescribed to take at home to help with nausea? And what are some important things that patients would need to know about each of those?
So it's very important that patients understand their nausea medications, both what has been given before chemotherapy and what is prescribed to be taken home. So there's several different anti-nausea medications that your doctor can prescribe for you. I'm going to discuss some of the common ones that are often prescribed after chemotherapy. However, your doctor may choose a different nausea medication for you to take as well. So if I don't mention one of the ones that you've been prescribed, it doesn't mean that's wrong. It's just that I'm going to go over the ones that are the more common ones that doctors prescribe after chemotherapy. So one of the most common anti-nausea drugs is a medication called ondansetron. And ondansetron comes in either a tablet that's just taken like you would take any other medication by mouth, or it can actually be an orally disintegrating tablet, which means that it's a tablet that can be placed under the tongue and it dissolves. And sometimes we use those orally disintegrating tablets if it's difficult to swallow because you're having some nausea. And so if you think it's an option that you may be interested, you can just ask your physician or your nurse practitioner to prescribe the orally disintegrating tablet for you. So ondansetron usually works within about 30 minutes of taking. So you do need to give a little bit of time to work before you see it ease your nausea. And two of the common side effects from ondansetron can include headaches. And if you're taking it regularly, it can also cause some constipation. So just a couple things to be aware of. Not all patients will experience those side effects, but those are just the more common ones. Another anti-nausea medication that's often prescribed is prochlorperazine or promethazine. Um, and these two medications work very similarly, but it just really depends on which one your provider would prefer to prescribe for you. They both, prochlorperazine and promethazine, can cause drowsiness. And so sometimes patients prefer to take the medication at night before bedtime. And you may notice, or sometimes your doctor will prescribe both ondansetron and prochlorperazine or promethazine, and it's just because they work differently to treat nausea. And I'll talk a little bit different in the next question we talk about with Dr. Perkey as far as why we use different nausea medications. But one more medication that may be prescribed to take after chemotherapy to help with nausea is dexamethasone. So dexamethasone is a steroid medication, and you may have been prescribed steroids for other reasons, even beyond when you're getting chemotherapy. But dexamethasone or steroids actually work pretty well to help to treat and prevent nausea. It's usually reserved for patients who are receiving chemotherapy with a higher likelihood to cause nausea or vomiting. So, there's patients that I mentioned that are more high risk. And dexamethasone, usually when it's prescribed to be taken after chemotherapy for 2 to 3 days, and it helps to prevent some of that delayed nausea I mentioned, that nausea that can happen after 24 hours after chemotherapy. So, if you've ever taken dexamethasone or steroid before, one of the common complaints of taking steroids is that they can cause insomnia or disturb sleep. And so, to minimize some of those sleep disruptions, it's best to take the dexamethasone earlier in the day. And often you may notice that the dexamethasone may be prescribed to take twice a day. And if that's the case, I usually tell patients that they want to try to get that second dose of the day in before about 4 p.m. So the earlier you can take it in the day, it's going to cause less of those sleep disturbances for you. And just another reminder, when you are taking steroids such as dexamethasone, you should also take them with food because they can cause upset stomach. So that's just a brief overview of 3 of the more commonly prescribed medications that you can be to take at home for nausea and vomiting. But like I said, sometimes your medical oncologist may prescribe something different.
Thanks for going over all of those, Nicole. And yeah, like Nicole said, there are definitely other medications that can be prescribed. These are just some of the more common ones. Always talk to your doctor about your particular regimen. I loved all the points you were making about dexamethasone. There are several different side effects that can happen with that drug, but the good news is that it's usually a temporary medication, often just one that you're taking for, just a couple to 3 days after chemotherapy, and not something that you'll typically be on for the long term. But one other, kind of positive side effect with dexamethasone that I hear about a lot of times is that sometimes it can actually increase your appetite. So if you may be dealing with some nausea, your dose of dexamethasone might actually help on those days that you're taking it, and you may feel a little bit more hungry. So that's one of the good things to note. But I wanted to talk a little bit about what to do when taking scheduled medications after chemo. So let's say someone has they've gotten all of their pre-medications, and they're taking their regularly scheduled medications like dexamethasone for 2 or 3 days after chemo, but they do notice that they're having some nausea still, despite all of that. Can you please walk us through when the patient should take their as needed medications like ondansetron or prochlorperazine, and how long before they should start to notice the benefit?
That's a great question, and I get that asked a lot by my patients when they're talking about and asking questions about nausea medications. And like Cassie said, some medications are scheduled to be taking a couple days after chemotherapy, like our dexamethasone, but some of the other medications, like the ondansetron and prochlorperazine, don't necessarily have to be taken unless you're experiencing nausea or vomiting. Now, that being said, we don't want you to try to be a hero and only take them if you're like on the verge of actually vomiting. These medications actually work best if they're taking at the first sign of nausea or vomiting. So if you notice yourself being a little queasy or just your stomach's not right, go ahead and take your anti-nausea medications. It's important. You don't want to wait to take your nausea medication until you actually are on the verge of vomiting because they don't work as well for that. As I also mentioned, many times you may be prescribed more than one anti-nausea medication that you use to take at home. And so one of the common questions that I get is that, which one do I take them take first if I have nausea? Or do I take them both at the same time? And those are great questions and things that I would be asking too if I had two pill bottles sitting in front of me. So, what I usually tell patients is that I usually recommend that you try one of the two medications if you have more than one. So, let's just take an example. Say you have both ondansetron and prochlorperazine at home. Typically, I'll tell a patient, first sign of nausea, you want to take that ondansetron first. And that ondansetron should start to take effect within about 30 minutes. And so if after that 30 minutes you're reaching about that hour mark that you are still experiencing nausea, you can go ahead and try the other nausea medication. Like if you have prochlorperazine at home. They work differently to treat your nausea, and it's okay if you take them as long as you've tried one first and then you go on to the other one. Now, if you're so say you take your ondansetron and you don't have any relief, and then you take the prochlorperazine, you don't have any relief. At that point, if you're still having issues where you're actively vomiting, or you have nausea that's preventing you from eating or drinking, it's really important that you call your medical oncologist office. So, I always stress to patients that, these nausea medications that we give you are to manage nausea and vomiting at home. If they're not working, especially if you're beyond 24 hours and you're still having symptoms where you're not eating or drinking or actively vomiting, you definitely want to make sure that you're calling into your medical oncologist office, because it can be a simple fix as them prescribing you a different anti-nausea medication. Or maybe they just need to see you in the office and make sure that everything's going okay. So, never hesitate to call the physician's office if you're still struggling with nausea and vomiting.
Yes, that is such an important point to make. Patients really need to understand that um, it, I think there's a misconception that nausea and vomiting is just something that everybody is going to have with chemotherapy. And really, with these medications, our goal is to try to make it as minimal as possible. So if you are, like Dr. McMullen said, if you are having a lot of nausea and vomiting despite taking these medications, that's not the expectation. We want to be able to help you manage that and bring it back down to a minimal level and something that's really manageable. I did also want to add on that regarding that onset of action, like when the medication is going to start to work. One thing with if you are prescribed ondansetron and specifically the oral disintegrating tablets, since those are ones that you can dissolve under your tongue, that actually can reach the bloodstream a little bit faster than if you were to take it like a normal pill and swallow it. So that's something to consider if you do have nausea cropping up, and you do have the opportunity to take a ondansetron disintegrating tablet. Just pop that under your tongue, and typically that can start to work a little bit faster than some of the regular pills that you would take and swallow. Although I will also clarify, because this is another common question I get, the oral disintegrating tablet can still be taken as a normal pill, like just swallowing it. Sometimes the taste of the disintegrating tablet can bother some patients. So if you don't like the taste, you can still take it as a regular pill that you would swallow. Um, but one other question we hear a lot of times is, should I avoid eating before coming in for chemo? And although this is kind of getting into the like a dietitian's realm or a nutritionist realm, Dr. McMullen, what is your advice for patients who are nervous about eating before getting treatment?
I think that this is a common question, because we know that nerves really does can lead to even some nausea as well as before we're even starting chemotherapy. But we do typically tell patients that you want to eat something small before coming into chemotherapy treatment. Um, if, especially if the treatment can take several hours, you might be there for a while. We also recommend that you pack some snacks. Now, you may be thinking like that's easier said than done, right? Because I'm nervous. It might be my first treatment. So if you do feel up to it, just try to eat something small, maybe something that's more high in carbohydrates, just give you that little bit of energy before you come in. But the one thing we don't tell patients to avoid eating. So as long as you're feeling up to it, then even after chemotherapy, you can continue to eat your normal diet. In my experience, if you do have an empty stomach, sometimes that can actually make you feel worse. And so we do encourage, like I said, to try to eat something before you come into chemo, and to try to continue your regular routine as you're, even after your treatment. Up to note, if you do forget for some reason to bring in some snacks, and if you do get hungry at the infusion center, a lot of times our infusion centers do have some light snacks that are available for patients. You just have to ask your nurse or the staff at the infusion center if they have something available for you.
Yes, do not be afraid to ask. Everyone is there to help you, and your nurse wants to make you feel as comfortable as possible. Uh, so, Dr. McMullen, for patients listening today, what questions should they be asking their care team about nausea and vomiting, just to wrap everything all up?
So the biggest thing is that no question is a silly question. I always tell my patients that. It's not nothing that you want to make sure that you're informed when you are starting your treatment for your cancer. So I can't stress enough that you need to know what your nausea medications are, how you're supposed to take them, and when you're supposed to take them. So things we just talked about all through this podcast. Most of the time, your doctor will send the prescriptions that for you to take at home to your local pharmacy before your first chemotherapy appointment. If you're able to, I encourage patients to, get those prescriptions filled, pick them up before your first appointment, and you can even bring them in with you to your chemotherapy appointment. And that way, your nurse, your doctor knows that you have them, and then they can go over them with you. Sometimes, if you have someone sitting there in front of you, having the medications in front of you and explaining them to you, it's easier for you to remember. Oh, that's the ondansetron's the O one, and that's just the one that my nurse told me to take first. Or prochlorperazine is the P one. It's the one that makes you sleepy. It's sometimes patients learn differently, so seeing the name of the drug may be easier to help you remember to understand the instructions that you were given. And then the final thing I always tell patients is to, make sure you know when to call your doctor if your nausea medications aren't working. So they may give you specific instructions or instructions like I mentioned before. If you're still having nausea and vomiting where it's interfering with your ability to eat, or if your symptoms are lasting longer than 24 hours and they're not being resolved with your anti-nausea medications, to make sure you call your medical oncologist office. So those are the big things, is just make sure, and then make sure that if for some reason your medical oncologist has not prescribed you anti-nausea medications, that you mention that to the nurse at your infusion center. Like I said, it's routinely done, but every once in a while it may fall through the cracks. So make sure that you at least ask if you need anti-nausea medications at home. In some certain instances, maybe there's a medication that you're receiving for chemotherapy, they don't need them at home, but for the most part, patients are often prescribed those medications, and you should be receiving them to take at home after chemotherapy.
That was a really good point, Dr. McMullen, to for patients to pick up those prescriptions before coming in for their first treatment, and just like, yeah, definitely have them with you. And not just for the first appointment to ask questions and figure out, exactly what the plan is, but also have your as needed medications like ondansetron or prochlorperazine with you whenever you're going out, just in case there was to be any nausea that pops up maybe unexpectedly. You just always want to have something with you on hand as you're going through treatment. Like Dr. McMullen said earlier, it's easier to manage nausea when you first start to feel a little bit queasy than when you feel like you're really really feeling poorly and maybe vomiting. So that's all for this episode of RxConnect. Thank you so much, Dr. McMullen, for joining us and sharing your insight. I think these are some really valuable key points for patients to understand and caregivers to understand, especially when first starting on chemotherapy. So, if you or a loved one has been diagnosed with cancer and are starting chemotherapy or immunotherapy, remember that nausea and vomiting can often be well managed with the right medications and planning. So be sure to ask your provider and your pharmacist about what to expect, how to take your medications at home, and of course, when to reach out if something doesn't feel right. I know we've said all of those things so many times on this podcast, but we really can't stress that enough. So, thank you so much for listening, and we'll be back next month with another topic to help support you during treatment. So, if you found this helpful, we'd love for you to share this episode with another friend or family member.
The RxConnect podcast is produced by the pharmacy operations team here at American Oncology Network and music composed by the Synth Dude. Make sure to check out all our episodes of the podcast by liking and subscribing to our YouTube channel.